Hey y'all. This is Plez and welcome to Scared of Beautiful. Thank you all for joining me. This is my first live broadcast and I'm so happy to be here with you all this evening. As you can see, the title is COVID-19, the vaccine and the Black community. So, as I told you all when I started this channel, if you're new here, welcome. My channel is all about enlightening people, educating people, empowering people, and setting us up to live our best lives, whether that's through entertainment, health and wellness, a little humor, whatever. We're just here to grow and learn together. So, for my first live interview, I wanted to bring on someone who can speak to something that's really serious that's affecting our community right now, which is the coronavirus pandemic. It's been over a year since COVID-19 started, and we have seen that it is having a disproportionate effect on the Black community. I'm not a doctor, I'm a lawyer. And so I wanted to bring someone who could speak to everything that's going on right now, someone who is also passionate about our community and what's going on. It's also important for Black people to have access to healthcare providers who look like them, who understand their experience, and who best know how to speak to everything that's going on in their lives. And because I know everyone doesn't have access to that where they live, or they may not have friends or family who are doctors, I decided to let you all borrow one of my friends and get to know her and hear her perspective as a frontline worker in this COVID-19 pandemic that we're going through. So I would like to introduce to some, and some of y'all already know her who are watching me from home, Dr. Bahati Harden. Yay! This is my good friend, Dr. Harden. We are both from Natchez, Mississippi, a little small town on the Mississippi River. We've been good friends for a long time. Growing up, our parents were super active in civil rights in Natchez, Mississippi. Her dad was one of the first African American city councilmen. My uncle was the first Black mayors of the city since Reconstruction. And my mom was very active in the NAACP and started a nationwide known museum called the National Association for the Preservation of African American Culture. And that museum still exists today. So if y'all go to Natchez, go tour it. It's a wonderful thing. Um, Dr. Harden and I are great friends. And when COVID kicked off, it was all over the place. I was scared, didn't know what to do, but I called her and she was able to give me some good advice on how to stay safe, how to make sure. And thankfully, a year later, I can honestly say that I have been COVID free this whole time. I first saw the how scarce hand sanitizer was getting, and I called Dr. Hart and said, "Is this thing real? Should I be worried?" And she was like, "Yeah, it's real." So I was able to go to Bath and Body Works that day and get me a couple of bottles. And we went from there. So welcome, Dr. Harden. How are
Thank
you?
you. Thank you. I'm well. I'm not sure if I need to push another button because I can't see anything, but I'm not sure if that's how the platform works. Should I be able to see myself or no?
Yes. You don't see both
I
of
don't
us?
see myself. I just see scheduled. Can you see me?
Yeah. Uh-huh.
You do see me. Um, Maybe I should go to Cam.
Yeah. Try that. Nope.
Mm,
Mm-mm.
Okay. It just says scheduled and it's grayed out.
Okay. Well, cut your
Okay.
camera back on for right now because I can see you.
Okay. How about now?
Uh,
Is that better?
let's see. No, that one made you kind of pixely.
Let me go, and this may have.
Oops, we lost her. We'll get her back. Let's see who we have. Thank you all for joining me. Thank you so much for the super chats. I see you, Bishop. Thank you from my panel member with All About the Tea. Hey, Miss Deline, Angela, Sandra Robinson, thank you so much for the super sticker. Hey, Marcella, thank you for joining me over here. Poised Nosologist, thank you, sis. Thank you for the super sticker. Hey, Swayze, that's one of my coworkers. Thank you so much for joining me. All right, let's see. Pretty Mrs. G, thank you so much for the super chats. Let's see, Leela Quijones. I hope I said that right. Thank you so much for the super sticker. And everybody else, Mirage Bond, thank you, sis. You're always so supportive. Let me get in here and let's see if we can get Dr. B back on.
All
Hey,
right.
you
I
got
can
it?
see is this great now? I can
Yes.
see myself. All right,
Yes.
good deal. I was
All
trying
right.
to pull up my computer.
Okay. We can
Great.
always see you, but I'm glad you can see yourself. So,
Okay.
like I said,
All right.
y'all, Dr. B is a wonderful doctor. She serves low income and greatly in need communities in Greenwood, Mississippi.
Mhm.
And she has always been gracious with me, sharing her knowledge. Let's see. Here we are before the world knew us.
Hi, Black
See if I can
Party.
take it off. Having some fun. So we are real friends.
Right, right.
And this is not just for YouTube. So, Dr. B, I've introduced them a little bit to you, but tell them about yourself.
Okay. Well, I am by training a rural physician, but I'm a family medicine physician by practice here. I'm in Greenwood, Mississippi, which is really sort of the seat of the Mississippi Delta. If you're from the South, then you kind of know what that means. I'm a native Natchezian, much like you, Plez. It says I'm on backstage, so I'm not sure if you can hear me or not. Can you hear me?
Yes.
Okay. All right. So let's just keep going. Um, so um, I don't know how far back you want me to go. So, undergraduate at Spelman, came home for medical school. I have a master's of science in public health from Tulane School of Public Health and Tropical Medicine, as well as a master's of science in biomedical science. And I've been practicing here in the Delta since 2013. This is definitely probably one of the most underserved communities if we exclude our native communities. And if we're talking about communities of color, I think the Delta, well, I know the Delta is probably number one in most of our what we would consider to be significant comorbidities. We're number one in heart disease and end-stage renal disease, uh, just about everything that you could think about, metabolic syndrome, which is obesity, diabetes, and dyslipidemia. So this, much like Playa said, is a labor of love. I love my patients here. I love what I'm doing here. I hope that I'm making an impact. I know they're making an impact on me. And so it has been difficult working here during COVID, but it has been rewarding for sure. My background in public health, and so I'll mention that prior to going back to medical school, I worked at the Centers for Disease Control and Prevention in Atlanta, Georgia, where it was a fellowship. And that was in 2003 or so, because it was right after the attack on our nation. So that was an interesting time to be at the CDC. And I think I was able to bring some of that knowledge base to what we are trying to do, or what we try to do in the Delta in terms of preparing for COVID-19, or being as prepared as we possibly could be.
Yes, definitely. You, as always, are a trusted consult of mine, but you have a wealth of
Likewise.
knowledge. And as always, I'm so proud of you. And that's why I knew you were the perfect person to bring onto the platform so that we can share. Y'all, we're about to get started, but just a few ground rules. This is, or I guess, knowledge. This is truly about educating. We
Right.
are not trying to persuade anyone for or against the vaccine,
Right.
but we are firm believers in science and in research.
Right.
So, whenever you all hear me talk, you know I'm always telling you to do your own research, consult your own doctors. This is not medical advice. This is just the words of someone who practices this on a daily basis, who has been working with COVID patients, since the beginning of this pandemic and hands on with their care in the hospitals. But no, this is not a substitute for doing your own due diligence and research, reaching out to your own healthcare providers, and ultimately praying and making the best decision for you. So it's going to be a well rounded interview. I'm hitting all the topics on how COVID has affected us, how we can best prepare to get ourselves out of this pandemic, live through the pandemic, and ultimately how we can better our health overall. So let's get started. Dr. B, did you really ever think you would see a worldwide pandemic? I know you worked at the CDC, but did you think you would see a worldwide pandemic in your lifetime?
Definitely not worldwide. And some of that may be a little bit of arrogance because we are American and we don't get to see what a lot of areas of the world get to see in terms of disease disparity and that sort of thing. We don't have sanitation issues here for the most part. So we don't have to deal with a lot of the health conditions that we would find, not just abroad, but in countries that are less industrialized than ours are. So definitely would not have thought that there would have been a pandemic during my lifetime at all, at all. I had that conversation daily with patients, especially my significantly elderly ones, centenarians and that sort of thing, that I just can't believe we're here. And then we're still here. So
Yes, no one, when everything shut down, it was like, oh, get enough food for 2 weeks. And here we are a year and almost a month or two later. It's
right,
craziness.
right.
How has it been for you working on the front lines of COVID?
Well, I mean, I'd say stressful. It definitely has been stressful. And I'm a person who manages stress probably pretty well. And stressful for lots of reasons because COVID has really placed a barrier or boundary in a lot of ways between care providers and their patients, between family members. I am an avid traveler, and you know that is sort of my sweet spot. That is my reprieve, and I haven't traveled, no passport stamps in 13 or 14 months. In December of 2019, I went to Morocco and Spain, a couple places with my mom, and we were coming back and we were hearing this chatter like in the international community, like at the end of these, which really was January, about a respiratory virus that was predominant in Asia, which we had considered taking a trip there. So it's a good thing we did not do that. But it has been stressful. I mean, I'm blessed because I have not been infected despite being on the front line. We've had a couple folks in my office to become ill, but we haven't lost any folks. I definitely do know providers that are not with us now, and I have lots of patients that have lost their fight against COVID, which has been really hard. And I think that's probably one of the reasons why I'm such a staunch supporter of interventions, whatever they might be. But I say stressful, but it actually hasn't been that bad. You know that I'm kind of a hermit, so the social distancing isn't that bad for me. And then I also have to say that my job is quite social, so I see people all day, every day. So I'm not like most folks where I'm not having any sort of social interaction. But it's been stressful. It has. Yeah.
Yeah, I can only imagine. Thank you for your service and for all of your counterparts. Like
Right.
you all really were fighting an unknown war that we didn't even know we would be facing. And I understand that COVID fatigue is real, for a lot of people.
Right.
We just have to figure out ways to navigate and get back to whatever normal we can get to
Right.
in post COVID life, with the vaccine being on the horizon and other things. And that's one of the other reasons why we wanted to do this interview now. Lots of states are opening up. I live in Louisiana, and some of our restrictions were lowered yesterday. But
Mhm.
also vaccines were open up to everybody over the age of 18 starting this past Monday. Mississippi is fast on that track. California, I think, is coming April 15th or 19th. New York, Florida, Texas, they're all getting there. So we want to arm you all with as much knowledge as possible on the vaccine, get some myths, some fact and fiction out there, but also talk about the development of the vaccine and why it may or may not be suitable for you in Black America. So now that it's been 1 year, we do have the statistics that show that COVID did have a disparate impact on African Americans, Black America, whatever you choose to identify as. And that was for a lot of reasons, mainly underlying health conditions, but also just the state of food deserts in our communities, the lack of access to health care and
Right.
to affordable housing, even. Working in Louisiana, there were a lot of homeless people that we had to hurry up and get off the streets because of COVID. COVID exposed a lot of inequity in America. And as you said, we don't live in a third world country. They say it's not,
Right.
but it really did expose a lot of the underbelly of the United States.
Right.
So,
Right.
have you seen the disparate impact or the disproportionate effect with COVID in your patients?
I would say so. I mean, not say so. Definitely, I have. And I think when we think about the reasons for that, probably one of the biggest reasons that we don't think about is that we're more likely to be exposed. We're the sanitation workers from my small community. I mean, you kind of know early on, our hospital system was actually really very proactive in trying to create a COVID unit, and to try to make sure that we were serving the needs of the patient population. So they asked me to chair that committee, and we were really able to set up a couple of things for the community that I think were beneficial. I mean, we still saw a large number of our infection rates were still high, as well as our death rates were as well. But I think based on our patient population, that was to be expected. And I hate to say it like that, but it's very true. And the reasons why it was expected, you said, access to care. Here in the Delta, there aren't that many medical providers here. Lots of folks, not just here, I think that's probably a nationwide thing, but in our more southern impoverished states, Mississippi, Louisiana, where there's no investment in Medicaid and those sorts of things, and people don't have the access that they should have to care or good and appropriate care. So from an infrastructure standpoint, we tried to make sure that we had a lot of things that we needed to have. And I'll have to say, I reached out. I know you probably remember that time because I was just so frustrated. I reached out to politicians and Benny Thompson, who's a congressman here, who my father knew, but I didn't really know him personally. I reached out to him, and he kind of explained the process by which monies are opened up or let down for the states, and then the governors and the states have to pull those monies down and use them for their states. So Mississippi, rarely does that in lots of instances, and I'm sure there was some of that was done, but not in the ways in which lots of other states did. So the access to care, the access to supplies for testing. We have a really good pharmacist or pharmacy team at my hospital. So early on, we've had most of the medicines, the du jour medicines. We had remdesivir very early. We've had BAM, the monoclonal antibodies, really very early. And we had two young pulmonologists that were recently trained. And so as a committee, we were consistently digesting the academic information, trying to figure out how we can make things better. And don't get me wrong, it was not a perfect system, and it's never going to be, and especially because we know that there are lots of multifactorial systems that are in play in areas like Mississippi and the Delta. But not to, Plez, you got to probably pull me back in because I'll go all off. But we're talking about the effect or the disparate effect on communities of color. Yeah, first and foremost, we're most likely to be exposed. Here we had lots of outbreaks associated with long-term care facilities or nursing homes. And the folks that are taking care of our senior family members very frequently look like me. most of those folks that are having one-to-one, very close contact with people are folks of color, are African American here in Mississippi. As well, those are the folks who are the sanitation workers, like I mentioned. Those are the folks that are the greeters at Walmart and the cashiers there. They're the people who are coming into contact with folks that have been exposed. And we know just based on the transmission cycle of this virus, 14 days sometimes before you have symptoms, those folks would have been exposed and infected before they even were aware that was the case. So in a place like the Delta, where we have poor access to care, we have a very, very large population of folks that live well below the poverty line. Um, we're going to have an increased incidence of comorbidities that are likely to be more fatal or associated with fatalities as far as COVID is concerned, and then increased exposure. So yeah, we were definitely hard hit, and then you add to that, this is a novel virus that a lot of folks don't know much about, and people are hesitant and resistant to take the advice that healthcare providers give them. Now, I say, luckily, I think and I hope and I know that my patients do trust me because I'm not going to do anything that's not beneficial to them. But I think a lot of patients question the healthcare system, and there's historical reference and reason for that to be the case. So yeah, yeah, we've had like as folks say in the Delta, we've had a hard road to hoe as far as COVID is concerned.
That's definitely a country saying.
I know, right?
Um,
Don't you love it?
what about, we've heard so much talk about our underlying health and existing comorbidities.
Right.
What are some of the leading comorbidities that are seen in the Black community that have affected complications from COVID that you've
So,
seen?
right. So metabolic syndrome, which, obesity, diabetes, dyslipidemia, issues with cholesterol, that sort of thing, that falls under that triad of metabolic syndrome. Also, I have a lot of folks here, and I don't know if it's because it's an agriculturally rich community here in the Delta, but lots of folks have lower and upper respiratory issues. And some of that, it could be even related to obesity and hyperventilation syndrome associated with that. Also, end-stage renal disease. Like I said, when I came here from Louisiana to Mississippi, I was just amazed at the number of young folks that are on dialysis. We have a ton of chronic kidney disease, end-stage renal disease here. We have lots of folks that have autoimmune diseases here in the Delta, which, that and malignancies definitely are going to lower your immune system's response to be able to fight off any sort of aggressive virus. I have the pleasure of being a medical director here for a Ryan White clinic, which is an HIV clinic. And so, Mississippi and Louisiana definitely have lots of folks that are diagnosed with HIV and or AIDS, and that would make a person much more susceptible to COVID, depending on if they're in treatment or not. Yeah, so just those few things, and of course heart disease, but these things are also interconnected, and we talked about that. I think I mentioned to you that for my sorority, I did a talk about heart disease, and we were talking about African American women being, the most disproportionately affected by heart disease, and that's hypertension first. Before we start thinking about congestive heart failure, any of those things, hypertension opens the door to heart disease, and we are disproportionately affected or afflicted with hypertension. So just so many things. Just so many things that
Okay. So basically, in layman's terms, y'all, what she said was high blood pressure, kidney disease, high blood pressure,
thank
kidney
you.
disease, heart disease, stroke, heart attack, all of those things. Getting your underlying health in order
Right,
is your first line of defense. If
right,
you don't have a primary care physician, a PCP, please
fine,
get one. I know Dr. B would tell me all the time how many patients she would encounter that did not know they had high blood pressure until they were in the hospital with COVID.
right,
Didn't know they had diabetes until they were in the hospital with COVID. So diabetes, the sugar, as we call it in the South, or your grandma calls it,
mm-hmm.
we need to do our yearly, at least a yearly physical to
Right.
know where we stand, on a yearly basis, so that these things don't catch us off guard.
Mhm.
All right.
And that's something really worth mentioning. I know we are pressed for time, but yeah, you'd be amazed at the number of people who pay for insurance every month and don't utilize that insurance just to get their regular routine checkup. Blue Cross Blue Shield, you can get 2 wellness exams every year. So for the most part, if you're well controlled, you get away with not having to pay anything or a nominal fee for your health care. Almost every insurance will allow for, screenings or your um, what they call a wellness exam. So sorry, I just had to throw that in there.
Yeah, no problem. High vibe. Thank you for the comment. He says COVID has been a wake up call in the Black community. We are an unhealthy population, but we can do something about metabolic diseases.
Right,
We agree. We
right. We talk
absolutely
about that
agree.
all the time. We talk about that all the time. And as a primary care physician, I mean, even especially during COVID, I have definitely packed on the pounds. And there's a gap between knowledge and action for us all the time, which is why I'm glad you're doing this because just what you've done over the last year has been so inspirational to everybody that you know. Whether or not we're making a change, we definitely know that.
So I was going to mention that later, but since you said it, and
Okay.
you're like, what did she do over the last year? So
Okay.
as I told you all, and people who've seen me on All About the Tea, COVID was serious for me. It scared me. I knew people who died, and I don't mean know of people. I mean, I knew people. My cousin's husband, he was a young preacher from home. He was only 34. He passed, actually, tomorrow will be a year. He passed on April 1. One of the ladies who was over the financial aid department at my law school, who I kind of looked up to as a mother in law school, Miss Nadine Ramsey, she passed maybe 2 or 3 days after him. And then I knew another person who died. So everything happened so quick. Stuff was shutting down. Louisiana went from like one case to 100 some cases in a week. And then someone died. I knew people who died within the first 2 weeks.
Right.
So I had been on, I'm still fat, but I had been on a weight loss journey for, it seems like, every year. And this was the time when God really spoke to me and was like, look, you have to get it together. And I know as Christians, if y'all are Christians, I am. In the church, we like to say, "Oh, I'm not gonna claim that," And so, no, you don't want to claim an illness or a disease, but God gives us doctors, scientists, statistics for a reason. And the people who were dying, especially early on in this, looked just like me. They were Black women, overweight or obese, with comorbidities. I have high blood pressure. And I knew my doctors had been telling me for years to lose weight. And so COVID was my time to do it. So thankfully, year to date, I have lost over 100 pounds just through diet and exercise.
Right.
I have not done any Jenny Craig. I didn't have any secret surgery. Couldn't have a surgery because everything was closed.
Right.
And I didn't want anything in my body that would cause inflammation. I pretty much just ate meat, fruit, and vegetables and only drank water. And I cooked at home for myself because everything was closed and I wasn't going out to fast food. And I exercise at home. I don't go to a gym. I walk 3 to 4 miles every day. And so far, I've done it. And so that's just a little testimony, but it's also inspiration that y'all can do it. If you need to do it, you can do it at home. If you have the money or if you think you need a surgery, great, go for it. But I want to let you know, firsthand testimony, it is doable at home. I still have about 90 pounds left to lose, but we're getting there. We're going. So sorry, enough about me. Um,
Yeah.
uh, all of that to say though, working to get yourself in better health overall, so that even if I did come into contact with COVID, hopefully I would be at a better place to fight it. Most of the people who die, there will be some people who die without comorbidities, but most of the people have these underlying comorbidities and they have BMIs over 40. So if your number is there, it's not about vanity. Although we all want to look good, it's about your health, and that's what this talk is about. So, all right, we've talked about the comorbidities and the bigger picture, how this affects the Black community. What do you think it's going to really take for the world to get back to quote unquote normal, whatever that's going to look like, close as we can get to our pre-COVID way of life?
If I'm honest, I'd say I don't think we're going to get back to that pre-COVID way of life. And we've kind of talked about that. I do think, I'm definitely a vaccine proponent. I think widespread vaccination is going to be the only way forward. I don't think that this is a virus. We keep hearing that this virus is going to run its course. I don't see that as happening. Even later in the questions when we get to them more in depth, that'll be a little bit more clear. But I've had patients that have COVID 2 or 3 times. So the likelihood, and each time, even if their acute symptoms aren't worse, their long-term outcomes are. They're having more thromboembolic events, which would be like strokes or DVTs and that sort of thing. So I don't have a good answer for that, but I definitely don't think that that's something that's coming in the near future. Just because from a human nature standpoint, as I see people falling back into habits that have been destructive as far as COVID is concerned, unless we have more widespread vaccination, I don't see it working out.
Okay.
Yeah.
So, since you said it, let's talk about the vaccine. There's a lot of distrust in the Black community around modern medicine. And
Right.
we talk about that all the time. Like, we're not sitting up here as people who don't understand. I personally don't necessarily trust all modern medicine. Birth control is one that I'm a big suspect of, but that's neither here nor there.
Right.
The distrust is not unfounded. We have a horrible history in this country of being used as experiments and being lied to about the purposes of different studies.
Right.
But how is this vaccine and its rollout different from what we've seen in the past? Most notably, the thing we hear about is the Tuskegee syphilis study.
Right. We've kind of talked about the Tuskegee syphilis study and how these things are not congruent. I think there's a lot of distrust and is warranted in our community. In some ways, definitely. We definitely have been used as guinea pigs. We've been harmed by the medical community in the United States and abroad. But I know it's difficult to try to say, we got to wipe clean here. And I don't know that I'm implying that, but I think just a little bit of trepidation can be helpful or healthy. But in this instance, when we think about the ways in which we try to have transparency in the pharmaceutical industry now, or the vaccine development industry now, then we've got to trust that I know this. I know I'm speaking to an audience that doesn't necessarily trust the medical community, so I don't know how to hedge this in a way that would probably be the most appropriate to say. But at this particular point, we're kind of up against a brick wall. So even as far as the vaccine is concerned, that's going to be our way out. And as far as the development of this vaccine, I think, and most vaccines, I think that we forget that this is a multi-stage process, right? Here in the U.S., the FDA has to approve any vaccine, and that process can be halted at any particular point. So the stages, and don't let me get too clinical here, but the stages when we think about vaccine development, there's a preclinical evaluation, and those are usually animal studies. Murine means mouse. Sometimes they are larger animals like primates. I see you laughing at me already. So it's a stepwise process. Like, I hear so many people talk about like this vaccine just came out of the blue. No, it has not. People have been working on mRNA vaccines for decades. And we talked about this when we were talking about which vaccine I wanted, or, like what I would do if I didn't get the vaccine that I was desired to get. But anyway, so we think about the preclinical stage. So that is using animal studies, and they're looking to measure whether or not there's an immune response to the vaccine. And I'm sorry, I have the other screen up so I can see myself. So that's why I'm kind of looking back and forth. Um, so so they test to see if there's an immune response, but then there's also toxicity studies involving these animals to decide whether or not there are safety concerns that need to be further evaluated before the stage is moved. And then there's 3 stages: phase 1, 2, and 3. And to be honest, there has been an accelerated development for this vaccine. So there was some melding of phase 1 and 2 and 2 and 3, but there still have been stringent requirements as far as this vaccine process has occurred. So when we think about phase 1, the goal is safety testing. And if I don't know if you have any clinical trial people in the comments. One of my really good friends from Spelman develops clinical and works on clinical trials, so she might type in some things there. So phase 1 is just going to be mainly safety testing. Those are really small groups. And when you start to hear, like, Morehouse School of Medicine participated, Meharry, these are schools that were created for education of students of color, and they have a commitment to our communities, right? So they were involved in all of these sort of phase trials. So the phase 1, you have these data safety and monitoring committees where they have vaccine experts as well as medical folks. They also have community players that are in place. And, again, they're at phase 1, they're looking at whether or not the vaccine elicits the immune response that you want, and if there's any toxicity. So if there's any severe reactions, the studies get halted right then. They're stopped at stage 1 phase 1 before they even go to phase 2 and 3, where you start to increase the size of the group, the cohort that you have. And then the 3 is the randomized blinded, where a person gets the vaccine or they get a placebo. And in a perfect world, it would be the person gets a vaccine, a placebo, or another vaccine if we're comparing the efficacy and that sort of thing against each vaccine. And the endpoint that you're looking at is, does the vaccine decrease infection? So like I said, it was an accelerated rate for this process, but it was definitely still measured. And it was one that had lots of checks and balances. And I think we also forget that SARS-CoV-2 is a part of a larger family of coronaviruses that have been heavily studied for some time. When that first SARS outbreak occurred, and then when MERS, which is Middle East Respiratory Syndrome, I think that's right. When those were occurring, there was already some buy-in from the vaccine companies to develop vaccines at that particular point. And so for the development of these mRNA vaccines is what I'm talking about, because of course the Johnson & Johnson is not an mRNA vaccine, but for the 2 that were the first to the market and the ones that most people took, those vaccines just piggybacked on research that was already there. Like, they had already identified the spike protein, which is present in all of those, in those 3 varied viruses. So it wasn't a situation where somebody just came up with something in a lab and just pushed it through. There had already been a lot of buy-in associated with it. And I think I sent you the PhD, the one of the principal investigators that's been involved in that process, her webpage, and she's gotten a lot of acclaim, as she should, because she's been putting in hard work associated with the development of vaccines for coronaviruses. So this is not a vaccine that somebody just pulled out of their back pocket. It's the research, that the foundational research has been going on for some time, and it's been vetted. And for those of us who got vaccinated very early, and I'm going into other questions now, but I was vaccinated, early on in December, and we participated there. So I wouldn't say I'm a part of a clinical trial, no, but I'm a part of the tracking process. And so even now, I'm still getting text messages once a week asking me if I have symptoms, if I've tested positive for COVID, and that sort of thing. So I don't know if that's where we were going with that part of the vaccine talk, because I know we wanted to talk about the 3 different vaccines as well. And
Yeah. So that question was just mainly to let people know, like, we've come a long way from the
right,
Tuskegee experiments.
yeah,
One, a lot of people often uh, throw in Tuskegee, but they don't really understand
They
what
don't
happened in
understand it.
Tuskegee.
Right.
In Tuskegee, men were, they had syphilis, and
We're not
we
treated.
knew
Right.
that penicillin was the cure,
Right.
but instead of them giving them the shot, giving them the cure,
Right.
they let it play out to see how syphilis affects your
Right.
brain, your in, you until you get to the end of the disease and die.
Right.
Um, Here, it would be like if we had something to stop COVID and we just let people die. So that's not really what's happening here. So that's kind of a off analogy. But also, because of what happened in Tuskegee, we there were demands and changes made to the scientific process that studies must undergo, with their transparency, with their warnings, with letting participants get out if they want to, things that weren't there back then. Um, so yes, there is a healthy dose of suspicion of anything in this country, might I add, but we do have to weigh the benefits with the negatives. And I'll just speak for myself. I was able to watch Dr. B and some of my other friends who are medical professionals who kind of be the guinea pigs and get their shots first. And I was able to call them or talk to them on Facebook and say, hey, which one did you get? How do you feel? What were your side effects? And hopefully you have someone close to you like that. If not, you can ask me my experience, or Dr. B, or someone in your family maybe. But this is just for knowledge if you don't have someone close to you to have those resources. As you stated, Dr. B, there are currently 3 vaccines approved in the United States: the Pfizer, Moderna, and the Johnson and Johnson. Are there really any key differences between these vaccines? And we had a question from Sherelle Williams. She wanted to know, is one vaccine better than the other, in your opinion?
That's kind of a loaded question, but I'm here to be transparent, so I will be. So the Pfizer and the Moderna are mRNA vaccines. So the Pfizer's both of those are 2-dose vaccines, 3 weeks in between Pfizer, 4 weeks in between Moderna. The efficacy was about the same if we think about, preventing severe disease. Moderna edged out a little bit in terms of fatalities. I think like in maybe 15,000 or something like that, it was 0 and 1 in 18,000 for Pfizer. And I'm talking about those because they need to be grouped together because they are mRNA driven vaccines. And then I'm sure you probably saw recently in the news media that Pfizer is about to, or they're trying to expand their FDA emergency status to include 12 to 15-year-olds. And they're currently, this week, they started vaccinating 11 the 5 to 11-year-olds. They started getting shots, I think this week or last week. And then they're looking to expand that to 6 months to 11-year-olds. And I know a lot of people have issues associated with that, and we probably don't have enough time to talk about all of those things. And so if you're a parent of a kid, you need to be speaking with your pediatrician. So we know, and what we're seeing in terms of cases that's where the cases are exploding. And we probably all at this point know someone who has a kid that has become really ill with COVID or post-COVID MISC. So that's really the only way that we're going to get back to some normalcy is by vaccinating kids or coming up with a treatment that we think is not going to be injurious, which we don't know because those are going to have some sort of experimental status. So the Janssen, which is Johnson and Johnson, is not an mRNA vaccine. It's a adenovirus. It's a vector vaccine. So when we think about the different vaccines, of course, there are mRNA, DNA, vector, they're live attenuated, which there are some live attenuated that are being studied. And the live attenuated are like the influenza that are the nasal spray. And so the idea associated with them wanting to have a nasal one is that the virus attacks and attaches in the mucosal, the respiratory mucosal areas. And so getting that humoral or systemic response that you're going to get from getting the injection, the vaccine injection, I guess there's some thought that live attenuated might be a good idea. So yeah, so these totally different from the mRNA vaccine. Also
I,
less efficacy. The
I
Johnson and
think you're
Johnson.
covering your mic.
Oh,
Yeah.
sorry. Which
Now you're
part?
good. Now
Okay.
you're good.
And so the Johnson and Johnson just has much less efficacy, and so at the end of the day, you need a vaccine. Whatever's available to you, take it. We very rarely are folks in the South in a situation where there's benefit. But for us here in the South, we've had almost unmitigated access to the two-dose vaccines, the mRNA vaccines. Lots of folks haven't taken them. And I'll just be, I know I should not even give this information as a provider because you need to get whatever vaccine is offered to you. And if you're in an area where you're offered the Johnson & Johnson, get that
Hold on,
vaccine.
B. Something is going on with your audio. Did you change something or move your hand or okay, now go.
Okay, what about now?
It's better. Maybe lean in more.
Okay, sorry. So the Johnson and Johnson, the efficacy is still less, and they're newer to the market, so we don't have the same amount of data that we have for the Pfizer and the Moderna as far as whether or not there will be significant side effects associated with it. So that's not to discourage you, it's just newer to the market. So for my patients, I'm just going to tell you the conversations I've had with my patients. I've encouraged them to get the two-dose vaccine, and that's because they have access here. So why not? Why not get, in my opinion, a better shot if you can take it? If you can have a vaccine that's more efficacious than another, why not take that vaccine? The truth of the matter is that everybody's not going to have access to that. And here in an industrialized country like the U.S., you're still having much greater access, better shot than folks all around the world. So if you can get the two-dose vaccine, I would say go for that. That's what I recommended to my family. My mom, I signed her up to get vaccinated. It was a fluke in the system that they let her get vaccinated. She did. So my idea is why are we waiting? Unless you're a super quarantiner, which I kind of am when I'm not at work, but most people are not, and most people are not going to mitigate their exposure to COVID. They say they are, but they're not. So if you have an opportunity to get a vaccine, of Johnson & Johnson is the only one. You don't have any side effects. You're not taking Rituxan or anything. Never had a negative exposure to any of the other vaccines. You haven't had monoclonal antibodies in the last 90 days, or you're more than 14 days off your quarantine, recently positive for COVID, and getting the vaccine is better than that.
Okay. Yeah, something's going on with your audio. We can barely hear you, but it's going down a little bit. It's distorting a
I think
little
it's
bit.
probably because I had that. Let's see if that's better. It pulled up on the other screen on YouTube. Is that better?
Yeah, now it's better.
It would probably create an interference because I had the channel up from YouTube so I could like it and all of that. And I could
Oh,
actually see because I can see on my screen. I
oh,
don't know
okay.
what's going on, but
All right. We just have a few more. Okay. So thank you so much for your opinion on that. Now we just want to go over a few things. I've been reading the internets, and so we want to educate here. We want to
right,
give as much fact-based knowledge as we have.
right.
So I want to give you a couple of things that I found on the internet regarding COVID and the vaccine, and you tell me if these things are fact and fiction.
Okay.
Fact or fiction, excuse me. So the first one that I heard was the COVID-19 vaccine enters your body and cells and changes your DNA. Is that fact or fiction?
Fiction. mRNA vaccines don't interact with or integrate into your DNA at all.
Okay. The next one is that the COVID-19 vaccine contains fetal tissues and implants or microchips. Is that fact or fiction?
Well, I'm going to say that's fiction. Now, one thing I would have to say, the Johnson & Johnson vaccine does use what we would call pluripotent cells or stem cells, but they are not from dead fetus. Like you can get a pluripotent stem cell from almost any type of tissue. So let's just say fiction. Let's just say fiction.
Okay.
Because it's not, I saw that too on the internet. That's not That's false.
Okay. So the next question is, or the next scenario I found, fact or fiction. The messenger RNA technology is new and was rushed to development for the vaccine. I think we kind of talked about that earlier, but is that fact or fiction?
That's fiction. That's fiction. Yeah, we kind of talked about that in the spike protein and how it gets into, the initial research knew all of that with the ACE2 receptors and the spike protein binding. So no, none of this is new.
Okay. The next one, getting the COVID-19 vaccine gives you COVID-19. It actually infects you with COVID-19. Is that fact or fiction?
Fiction. None of the vaccines can have virus in them that can replicate. So they can't cause disease. None of the vaccines. Zero.
Okay. The next one that I have is that the COVID-19 vaccine can affect a woman's fertility. Is that fact or fiction?
That's fiction. Now, one thing I can, so you say woman's fertility, that's fiction. The vaccine hasn't been heavily studied in pregnant women. So, we know that it's safe, but they were not included in these vaccine studies. Like the new ones that are coming are going to include, and they're going to double down and do additional studies for pregnant women that involve in their data committees. They're going to have OBGYNs and that sort of thing in there, but no, they don't affect fertility. They could. Sorry.
Okay. And one that I got from the comments that we're going by, Swayze Carr wants to know, is it true that, well, I guess we can do a fact or fiction. Is it fact or fiction that certain blood types are more resistant to COVID?
That has not been proven definitively. We talked about that early on, and one of my really good friends is O positive, and we talked about that, and I'm an A negative person, so yeah, there's no clinical proof that that's the case. There was some anecdotal evidence, and so it's so amazing to me that people will follow the clinical proof and shun that the anecdotal, but no, so there's no clinical proof of that right now. Might it be, after we do lots of studies, possibly, but it's going to be difficult to how are you going to exclude bias and confounders there? I don't know how you do that. How would you get a big enough cohort or group of folks with a specific blood type that have no comorbidities first? How are you going to, I don't know, so we don't know that for sure yet.
Okay. Your sound still keeps going in and out, but I can hear you. It's just getting really low.
Okay.
Now it's better. Yeah. We have a question. I put it up on the screen. Miss Leah wants to know, will we have to have a booster later in the year or next year, in your opinion?
I'm thinking in a year we might. I read a couple of articles yesterday implying that there's a possibility that we might. And we have to remember these vaccines are new. And so the likelihood that we might have long-term antibody production, I think we're probably going to have a booster. So yeah, I think so. I'll be taking my booster. But I think we're probably going to have a booster.
Another question that just came in is with Jessica Hardy. She wants to know, Dr. B, how long do you think it will take for us to get to herd immunity?
Well, right now, our vaccination percentage is so low. We're not even at 25%. So I don't know that we're going to get to herd. We'd have to have greater buy-in. Hats off to our president for trying to really ramp up vaccination efforts and smoking that kind of thing out. But I don't know about herd immunity. So that the idea, not a long time. We talked about the small, we wouldn't consider herd immunity, but just the idea that folks that are vaccinated can gather in small gatherings kind of plays to that idea. We're so far off from that. Our percentages of vaccination of vaccinated folks nowhere near that. Not right there.
Okay.
We talked about the variants out there. I'm not an expert. I'm not an epigeneticist.
Your audio keeps going out.
sorry.
Every time you leave here.
I'm not evidence. Yeah, and you know, this is a joke, but my mom swears that I'm a mumbler. She's like, "As you got older, you mumble all the time."
It's not that. It's like your audio.
I need to lean in. Yeah.
Yeah. Okay. So Mina Hill, thank you for the super chat. Sis, thanks for the support. She says she's getting the second shot tomorrow. Will this one make her ill?
So everybody's immune response is different. You know, I shared my vaccine process, and I had symptoms with both vaccines. The second one just made me feel really wiped out, tired in a way that I had not felt before. It was less than 24 hours that I had that symptom. So, and the interesting thing about that, there's some anecdotal things that say that the older that you are, likelihood that you're having these increases in symptoms or this. My mom, for example, didn't have any symptoms. Neither did my sister, so I guess that goes against that. My sister's only a couple years older than I am. She didn't have any. Neither did her husband. So it's just each individual's immune system. It's a case by case thing. But I'd be prepared for it to happen. Make sure you have some Tylenol or Novocaine, and take the day. Jobs allowed to be office vaccinated.
Okay. You might want to either lean in more or
okay. All right. Yeah.
Right. Or okay, let me see. We had another question. Will this be Cindy C wants to know, will this be an annual shot like the flu shot?
I think that's what the other person was just asking, and I'm saying we don't know yet, but I wouldn't doubt that. And I'm not against getting a booster anyway, because I think that we're going to probably need that as we have more variants crop up. You know, this knowledge is evolving. I think that's harder for people to wrap their minds around, because we're typically not practicing, or medicine is not usually a real time thing for this type of medicine. So I don't know, but I think so.
Okay. Queen Riri wants to know, do you have an opinion on whether or not you should take the vaccine if you have Crohn's or UC, which I think is ulcerative colitis. Yes.
It is ulcerative colitis. So if she's not taking Rituxan, this is a conversation for her to have most specifically with her rheumatologist. As I mentioned before, I have a lot of patients here who have autoimmune diseases, and I only have 2 that are taking the medicine that we think needs to be held after the vaccination, a little bit prior to and then after the vaccination. And their rheumatologist wrote me letters and said, get this patient vaccinated and we'll just hold the medicine. So that's a conversation for her to have with a clinician that's treating those specific medical problems, to be sure. But it is not a specific contraindication unless she's taking those medicines, and she'll know what those medicines are for getting the vaccine. But speak with your rheumatologist, or even, for those you see in Crohn's, you may just be seeing a gastroenterologist, and they'll be able to give you greater insight about that specifically.
Okay. I have another question. We know that all viruses, mutate and change, but as we know, there are some significant, the South African strain and some other strains out there. Right. Do you think it's worth it to still get vaccinated, even though we have these new strains on the horizon that are growing throughout the country?
I do. Any vaccine that you're going to get is not going to eliminate the possibility that you could get infected with the virus. There's still a real possibility that you can less likely, much less likely, but most importantly, less likely that you would become really ill and or die associated with it. But no, I'm recommending to all my patients get vaccinated now. I do think, we've talked about this before. I'm not a psychic or any or seer or any of that, but I anticipate we're probably going to have another wave, just with the states opening up the way that they are, and folks just really relaxing their standards for social isolation. So yeah, if you have an opportunity to get vaccinated now.
Okay. Yeah. All right, Doc.
You know,
You
that.
know,
I think the
so
last thing you might want to hit, because there are people that are going to be present that want to talk about things that you can do if they're not ready for the vaccine. Um,
um yeah, wait, we have just a few more and then
okay,
yeah, we'll get there.
okay,
We can you go a little bit longer?
yeah,
Probably about 10 more minutes. Yeah,
yeah,
I can go. So, okay. Um I hear you, Doc. I hear you, but I've already had
you
COVID.
know,
I'm speaking as one
oh,
of
person,
yeah. I'm
yeah.
some other person right now. I've
Hmm.
already had COVID and I'm immune. I don't need a vaccine, right?
But you're not immune. That's kind of the thing. I think I mentioned before that I've had multiple patients that have had COVID more than one time. So yeah, you're not immune just because you've become ill with COVID. No.
Okay. All
Mhm.
right. So I'm not immune. I hear you about that. I got my vaccine. So that means I can hop on a plane tomorrow. I don't have to wear my mask. I can go to visit my family this Easter,
Lord,
right?
I wish. If we were able to hop on planes, I'd be on a plane right now. No. I mean, so I am also a measured person. So and I don't like to take unnecessary risk. Like why would I put myself and then we've had this conversation about folks that have traveled to not just places that were endemic, but places that are very impoverished and potentially put those citizens at risk for no reason. And that same energy you should apply to your family members. I cannot tell you the number of patients that I have had who were infected by their family members. And the number of patients, and I love the little old people. Please, I love all my patients, but my older patients, and I've had so many to die from COVID, and almost every one of them, it was because there was a family member that brought COVID into the fold. Almost every one, and it was unnecessary. Almost every single one. So, just be responsible. Really think about it. I do understand that folks want to be around their family. My sister is a healthcare provider in Georgia and Savannah, and we're very close. My family's a close knit family, and I don't know when was the last time I saw her, but she's been vaccinated. Her husband as well. My nephew's under the age of course, under the age of 16. He's under the age of 12, so he can't get vaccinated right now. And so we've just had to forego all types of things. We've had to do 70-year celebration for my mom and do it through Zoom and socially distance. And that's just where we are right now. So I know folks want to gather for Easter. And if you do, just make sure you wear your mask. That's not going to be a catch-all, but minimally do that. Minimally try to distance yourself. Try to keep 6 feet between you and your loved ones. If you're going to visit an elderly family member, just be smart about it. Like, who wants to live with the guilt of knowing that they potentially infected a family member and they lost their fight? Not me. No. So, I don't know if I
I
answered, but yeah, wear your mask. Wear your mask anyway. You know,
I I hear you. I hear you, Doc. But the mask sucks. I can't breathe. Isn't this mask lowering my oxygen levels and negatively affecting my lungs anyway?
negative. That's not. I mean, studies have shown that that's not the case. And I can tell you, as a person who wears an N95 for, heck, most of the day, that's a no go. Now, it will definitely cause you to have bruising. It will mess your skin up and all that. I mean, the N95s and that sort of thing. But just a regular cloth mask, man, I don't even know what I wear. I mean, like a cloth mask. Come on, that is. I mean, I guess it's perspective, but yeah, to wear that mask and be uncomfortable just for a little while to protect somebody else, isn't that worth it? Totally worth it. But yeah, it's not affecting your oxygen saturations at all.
Okay.
Yeah.
So I hear you. I'll keep wearing my mask, but this vaccine, I don't know. I'm still a little skeptical. I don't want them experimenting on me. You should go first. You told us you went first already, but do you recommend the vaccine to your family and friends?
Yeah, for sure. I mentioned that my mom, so I got vaccinated. I was vaccinated the first day it was available. I was just about the first person there in line. Just because, I didn't want that, and I still don't want that barrier between me and the people that I'm charged with taking care of. I wanted to be able to go out and do what I needed to do and know that I'm protecting myself and hence my family and my legacy in the best ways that I could. But my mom, who is like my rider, my best friend, yeah, I I actually text her and my sister for support and said, "Hey, mom, your appointment is." She said she stayed to get vaccinated, and she didn't buck the system because she also knew, of course, how I was socially distancing from my family and friends, and she was ready to kind of be over that and to be able to spend some time probably with me and maybe some of her friends, which I completely, am I'm like the parent in terms of like, because I've had an opportunity to see what COVID can do and don't want that for my friends and family. Don't want that for my patients. Don't want that for anybody. Um, and so, yeah, my sister, like I said, is a healthcare provider. So she was vaccinated and she owns her own practice. So she she has encouraged lots of her staff members to become vaccinated, to get vaccinated, and they've had some slip ups there in her office because folks haven't gotten vaccinated and they've suffered the consequence of that, unfortunately. So there's only one of my close family members that's not vaccinated, and I'm on them. Plez, you know me, so I'm on them in a nice, loving way. My close friends, everybody that I mean, because I love my friends and family, and I want to see them on the other side of this, and I know that the vaccine has the potential to do that for them. We even talked about that article, and I can tell you about friends that have been vaccinated and had COVID infections in their family, widespread infections. To come through their house since they've been vaccinated as healthcare providers, and they were never positive, never had symptoms. And those are just, that's not that those studies wouldn't fly peer review, but I'm just saying I know a ton of folks that have had lots of exposure after getting vaccinated and didn't become ill and were not infected to their knowledge. So, yeah, I
Okay.
recommend.
Okay, we
I
have
was pushing
one.
you. I was pushing you to get.
Well, yes, you were. I have one more question that they're asking about the vaccine. Do you think it's safe, in your opinion, for people who have shellfish allergies to take the vaccine?
Well, so two, I vaccinated. Well, I didn't because I've been unable to get vaccine for my patients, but there are a couple of clinics and they have been really helpful in vaccinating for me, my patients who who've had anaphylactic responses to any medicines and or shellfish allergies. Those are not contraindications, but those patients that I do have, they have EpiPens on board and they've had most of the ones that have shellfish allergies, they also have chitin, so they can't take capsules, all types of things. Plastic jars sometimes will cause them to have an allergic response. So they were prepared. My patients that have those allergies wanted to get vaccinated. And so I was able to find clinics that would let them sit for, excuse me, I'm sorry, for 30 minutes after they were vaccinated, one or two for an hour just to address their nerves, and they did fine with it. But as in any situation, they need to speak with their provider. And a lot of those patients see allergy immunology, and I had already reached out to them. I've been proactive about this kind of thing for my patients, calling everybody, telling them to go get vaccinated. And so the immunology specialists I haven't had one patient that they said don't vaccinate. Varied all types of situations. So if you have that type of allergy, I'm sure you see an allergist. Contact them just to be sure. But for my specific patients whose medical care I'm involved in, none of them, they've all gotten vaccinated. Or I've
Okay.
encouraged them to be vaccinated.
Okay, and that covers, somebody asked about egg allergies. That covers all allergies, right? That's
Right,
your
right,
advice for all
right. It's
allergies.
not like
Okay.
influenza. One of my really good friends who's a physician has a egg allergy and has had difficulty with influenza and other vaccines like that, but not with this type
Okay. Just next time lean in a little bit again.
of
That's okay. Um, so Dr. B has given you all her perspective. As she said, she
vaccine.
highly encouraged me to get vaccinated, excuse me. After speaking with her, consulting my own primary care physician and some of my specialists, and praying. and doing my own little research because
Right.
Dr. B can tell you I will
Yes.
read and research and pull up a good medical journal myself,
Yes.
honey. Anytime I go to the doctor and get some blood work, I call her and I'm like, this means this, right? And she's like,
Right.
so even if you aren't as anal retentive about it as me, I will be honest and transparent and let you all know that I did choose to get vaccinated. I shared it on my Instagram. I got the Moderna. I go in for my second shot in about a week and a half. And for me, I made this personal decision because I have parents. I'm blessed to still have both of my parents. I have an 81-year-old father, a 74-year-old mother, and lots of my aunts and uncles. Pretty much my whole family is in their 60s, 70s, and 80s. I never want to be a threat to them.
Right.
I couldn't imagine being a threat to them. And I miss them. I miss hugs. I miss concerts, all the things that we talk about, like on Sing Along Sundays. I miss us being able to get together and fellowship. I love a good game night. I love
Yeah.
a good spades tournament. All the things that I used to do for fun. The casino, I haven't been anywhere, y'all. So, as Dr. B said, travel. We both share a love of travel. It's hard not being able to do these things. And I just want us to be able to get back to the, best life that we can live. For me, the straw that kind of broke the camel's back, or I guess the finalizing point was I'll share my screen and show you all um, something that I saw online back in early March. So this article is from March 9th of this year. And this is a lady in Texas, 40 woman loses husband and two children to COVID-19. This Black woman lost her husband and her two children. Her daughter was 38. Her son was 34. And she lost both of them, all three of them, excuse me, to COVID.
Right.
The mother who survived was the only one in the family who had been vaccinated. And so for me, knowing people who passed away, seeing this story over and over again, I remember later last year, a few months into the pandemic, we were having stories like this a lot out of Georgia, out of Michigan, of
Mhm.
like Dr. B said, almost whole families wiped
Right.
out because of COVID. And this lady's children, to be honest, they look like me. They were in their 30s, but
Right.
they're heavier, and I don't know their medical history. They may have had some comorbidities. So for me, this was just kind of one of the reasons where it was like, you know what, I need to go on and do this. Thankfully, I did not have any strong reactions to my first shot. I still have to get the second shot. But the first shot, I had the things that they tell you may have. I had a slight headache. Um, and I had pain around the injection site. I have had some friends that say the pain is so bad they can't lift their arm. My pain wasn't like that. It felt, like I had a shot that day, but it wasn't, anything significant. I didn't even have to take Tylenol, ibuprofen, or anything. And the next day I was fine. But as I always tell you all, you do your own research. Talk to
Right.
your team of healthcare providers. If you are a praying person, pray to your God, whoever that may be, and make the best decisions for you and your family.
Right.
As Dr. B said, if you feel like you can't get the vaccine or don't want to get the vaccine, it's still uncomfortable for you right now, mask up. I mask every time I leave the house, even when I go through the drive-through at Chick-fil-A to get a salad. I put on my mask. I want to be respectful to other people.
Right.
Um, I wash my hands. I keep hand sanitizer on me. I got some neat little Purell that I keep on my keychain. So yeah, be safe.
Right.
We want as many of us to make it out of this thing alive as possible. Lastly, the last question that I had, Dr. B, is hey, we've talked about all of these wonderful things. We've talked about how it affects our community. We've talked about the mask. We've talked about the vaccine. And I hear you, but I'm still not ready. What are some natural and holistic things that I can do to help build my immune system so that my body can better fight off this disease if I encounter it?
So of course, when we know you want to optimize your immune health, there's a lot of information going on about, vitamin D deficiencies, which can be difficult and lead to morbidity, period. But I want to encourage folks, and I think
Lean in some more again.
we've had this conversation about Paracelsus, way forever ago said something that I'll paraphrase as the dose makes the poison. So we have to be very cognizant. I'm a person who grew up with a mother who's very much a naturopath and employed a lot of holistic things, and so I do that as well. But I think I know for a lot of my patients who have multiple chronic illnesses and comorbidities, they have to be very careful. For example, vitamin D deficiency is a big thing. Communities of color, we both have talked about deficiencies and the need to
Hold on a little, Dr. B. I try to, for some reason, your mic sounds distorted a little bit.
Let me see if I can turn it up. I
Now,
don't know.
that.
Okay. So we've both talked about vitamin D deficiencies and the need to supplement, but we have to be mindful. You heard me say the dose makes the poison. So we have fat soluble vitamins. Those are K, A, D, and E. You can get too much of those. A lot of our other vitamins and minerals that we take, we're just going to process those through our urinary tract and urinate those out. But vitamin D is a fat soluble. It'll hang around. It also can cause you to have kidney stones if you get too much of D calcium. So, taking an appropriate or healthy amount of supplements and also knowing your numbers. If you're not significantly D deficient, you don't need to be taking 5,000 units every day, or like some of my patients who recently had stones, 50,000 units.
Hold on again. It's distorted again.
I don't know what's going on.
Yeah, it's good.
Okay. I'm not sure what you heard me say. Probably about the vitamin D being K, A, D, and E. We talk about this all the time. That everything that is considered to be natural and holistic isn't for every person. So if you have a D deficiency, you definitely need to replete that. So that was the idea when we think about folks that might have had a more significant or a very negative response to the corona vaccine, not vaccine, the COVID virus, were folks that were really D deficient, which African Americans we typically can be. And we talked before about the complex relationship between metabolism of what we eat and D and into a usable source for our bodies. So I see so much about D repletion. Just make sure you're not overdoing it, because of course we talked about this, and I told you I had patients who've had stones, kidney stones associated with very super therapeutic or too high levels of vitamin D and calcium. So, when COVID first came up, I kind of told you what I was telling my patients about supplements to take, those multiple supplements that have mag, calcium, and a little bit of D in them. But one of the most important things you got to do is what you're working on doing, obtaining a normal, healthy BMI, because we know obesity is probably one of the leading risk factors. Address your chronic illnesses. Make sure you're managing and mitigating those in ways in which, if you are exposed, you'll possibly be able to fight the virus. Practice good hygiene, hand or otherwise, making sure that you social distance. So as I mentioned before, I think you probably heard and that my mom is into naturopathy, is kind of a naturopath, and has been my entire life. I think you got to educate yourself about what vitamin supplementation means, and where you might have deficiencies and what that looks like, and what things you might need to replete or replace. So there's no one blueprint for every person. So we talked about, at the time, vitamin C and the role that it can have in preventing respiratory illnesses, as well as the severity of respiratory illnesses. But you can get too much of things, is what I'm saying. Too much of some supplements might cause you to have palpitations and everything is cardiac abnormalities. So just be careful when you're doing that. The things that you can do are going to be exercising, eating an appropriate diet, and managing your chronic medical illnesses. I think those are going to be the best things. Because people are always looking. I told one of my cousins this. People are looking for folks to tell them, "Oh, you just have to take this supplement." So that's not congruent with reality. I
Mm-hmm.
say it like that, but it's just not. But anything that's going to improve your immune system, yeah, that gives you a fighting chance. We don't know that that's going to be something that would prevent you from becoming very ill with COVID, but decreasing your weight, addressing obesity, um, managing chronic kidney disease, diabetes, those kind of things. Those are the things that you should be doing. And avoiding the virus in all the ways that you've already talked about, Liz. That's what I would recommend.
Okay. So for those who couldn't hear if the sound is too low, she basically said make sure that, as we talked about earlier, if you don't have a primary care physician, get one. Get your yearly physicals and your baseline blood work to know if you're even deficient on some of these things. Vitamin D3 is essential to your immune health. However, too much of anything is not good as well. So, in the African American community, the Black community, usually we are notoriously low in vitamin D because a lot of us don't get enough sun. And when we do, the sun has a harder time getting through to our cells because of our wonderful melanin. So sometimes you're low. Dr. B and I have always talked that we both have been on like high dose um, uh, doses of vitamin D for years because we were too low. Well, as Dr. B said, due to my lifestyle change of going outside, walking more, trying to lose more weight, also because of COVID, I started taking a lower dose daily, like a over the counter D3. So 5,000 I use, not 50,000, y'all. You just get one a day. So my 5,000 I use, due to that and walking outside, I'm now at a normal, healthy vitamin D range. That's where you need to be. That will help optimize your immune system.
Right.
Also, like she said, regular sleep, exercise. These are things that keeps our body normally functioning, regularly going as it should. Vitamin C is good, but again, you don't need to overdo it.
Right.
A daily multivitamin is good for everyone. A probiotic, that's also good to keep your body just normally functioning at its optimum level. Lastly, zinc. But as she said, none of this so far has been proven to be a cure. And that's what we want to caution against.
And
Just
Plez, remind them that zinc at a certain dose causes you to have copper deficiency, which is a trace metal that we don't think about needing, and most people don't get that in there, or they don't cook in copper pots, or they don't get. Anyway, that's a whole nother, and that's what I mean about naturopathy. Sometimes you gotta investigate it a little bit more. But zinc, and we talked about the 25 versus the 50 repletion. Over time, you're going to start to deplete your copper stores. So that's something to be cognizant.
absolutely. So don't just think loading up on vitamins is going to help you. As she said, I don't know if you all heard it because it was a little low, but ultimately your body and your system gets overloaded with these things and you just pee it out anyway. So you think you're doing well, you're really just spending a lot of money on vitamins that you may not even need. But as she said, particularly with vitamin K, which is potassium, that's something that really affects your heart health. So if you don't have low potassium, which is why you need to go to your doctor and do your regular blood work, you don't need to be loading up on potassium because it will cause irregular heart rates and other issues.
Right. And vitamin K, now that has to do with coagulopathy. So they don't need to be taking vitamin K, not potassium, just
I'm
K.
sorry.
If they're taking vitamin K, they need to be talking to I'm really getting tired. Like they need to talk to somebody.
I apologize. Yeah, I was just the sound. Somebody said we could hear her. Okay, y'all. I'm sorry. The sound was kind of lower, distorted on my end, so I didn't know if y'all could hear everything.
Okay.
But yeah, so that's basically, someone had asked that type of question. Did Dr. B believe that vitamins like zinc, vitamin D, vitamin C, I think it was Marcella, shout out Marcella, had asked that question. And so that was
And
actually
I
one
took
of my
those,
list of
so
things.
yeah, so I definitely, as a person, because when COVID was hitting and we weren't getting the type of sleep and all those kind of rest that we needed, you and I both know that I definitely am a proponent of taking vitamins, and I was doing that, the supplement, but at a healthy dose, at an appropriate dose.
Mm-hmm.
Yeah, yeah. So yeah, Marcella, those can be helpful at a healthy dose.
Okay. I think let me look and see. I had a couple more questions that people wrote in the comments written down. Oh, the last question that I had written down, someone asked was, do you envision that the United States will become a mask wearing society when we have flu-like symptoms in the future? Do you
That's
think
a
the
good
mask will
question.
ever go away?
I don't know. That's a great question. As a person that's traveled throughout Asia where they are mask wearing societies, I don't know. I don't know. That's a great question. And that's a question amongst my colleagues. We've had that question. So that's a really good question. I don't know. I don't know.
Okay.
Yeah.
Well, I think that is it. We've come to the end. Like I told you all at the beginning, overall, this was just a talk where we could get the truth from a healthcare professional, a doctor who has worked on the front lines of this pandemic, who looks like all of us, and who can address our concerns from the unique place that we stand in as Black Americans. This virus has affected us at a disproportionate rate. We are dying at rates higher than other cultures and ethnicities in America. As we said before, that's largely caused by some underlying healthcare issues. Also, the lack of access to resources and food in our communities. Um, Regular healthcare appointments. So if you, as Dr. B said, if you have access to insurance, make sure you're using it. Make sure you're putting yourself and your health first, so
Right.
that hopefully if you counteract this virus, your body will be able to fight it off on its own. Um, because we're still in it and the virus is highly unpredictable, and no one knows. Me and Dr. B talk about this all the time. One person gets it and it's like a cold, one person has no symptoms, and
Yeah.
unfortunately some end up in the hospital and on ventilators. So the crapshoot is you don't know how it's going to affect you.
Right.
And so to help us get out of this, masks, washing your hands, great hygiene is important. But now that the vaccine is available and will be rolling out in lots of states now at a mass scale, I wanted to give you all words directly from a doctor who's in it and who has had the vaccine and gives her honest opinion about everything that we know so far regarding the vaccine. So I hope you all enjoyed it. I hope if you're new, like I said, to Scared of Beautiful, please subscribe to the channel, like this video, leave your comments. If you have questions that we weren't able to get that I couldn't see, um, leave them in the comments, or you can hit me up on Instagram, send me a email or anything, and maybe I can convince Dr. B to do like a monthly healthcare kind of chat. Not just about COVID, but just about questions that you all may have from a doctor's perspective. Who knows? Like I told y'all before, we're great friends.
Yeah.
I'm the lawyer, she's the doctor. I'm the
Right.
Delta, she's the AKA.
Right.
So Deltas and AKAs can be friends, y'all.
Yes. Yes.
Um, but no, I respect her and love her so much,
Same.
and she's
Same.
always been a great supporter of me, even with starting my channel. And I hope you all enjoyed. I hope you all were informed and educated, as that was our goal. So now you are armed with some education. Go out, do your own research, pray
Right.
about it, and make the best decision that you can for you and your family. All right. See
Right.
y'all later. Thanks.
Bye.
Bye.
Thanks, Plez.